Brian Turner. I'm the CEO for Solvista Health. We're the community mental health center and substance use treatment provider that serves Chaffee, Fremont, Custer, and Lake counties. Today we're breaking ground on our Regional Assessment Center, which is a higher level of care for mental health and substance use treatment. Solvista has been a community nonprofit for 60 years in this community and across this region. And while this represents a level of care that we've not provided before, it's the perfect complement to what we have been doing for the last 60 years. And that is outpatient, ongoing, collaborative care, multidisciplinary treatment, whether it be individual or group therapy, psychiatry, case management, peer services, care coordination. It's about the entire continuum of services. And this is one glaring void that we've had for a long time. And so by putting this piece of the continuum in place, we're really going to be able to help people get on the path towards ongoing recovery and wellness. It took a lot of collaboration and partnership and passion from stakeholders, community partners, from all over this region to come together over a course of years to plan not only the building design itself, but the programs that are going to be housed within it. But what we're solving with this project is bringing care into our own communities so that people don't have to leave their communities, their connections, their support systems, their network of care when they should be better served here in our own communities. This project's important to me because I've dedicated my life to working in the mental health and substance use treatment field. We have all experienced a mental health challenge or a substance abuse challenge, either ourselves directly or indirectly, whether it be a friend, a family member, a colleague, and I'm no different than anybody else. This project's important to me because I've lost people to suicide. I've lost people to addiction. And this is an effort that is going to do something about it. We're going to be coming together and providing a level of care that absolutely will be saving lives. This is a matter of life and death, and this is the opportunity that we have to do something about it right now.
Commitment, dedication, vision. These are all qualities that have been essential for Solvista Health to get to this critical moment in our region's history. Solvista Health's unwavering leadership, partnership, and innovation, and most of all, perseverance over the years, have paved the way for our Regional Assessment Center to become a reality. We can now finally offer our community a continuum of care for those living with substance abuse and addiction. No longer will they and their loved ones have to travel to faraway places like the Front Range to receive the services and supports vital to thrive and vital to find a path to recovery.
The Regional Assessment Center will undoubtedly go a long way to helping meet the mental health needs in our region. We look forward to having crisis stabilization, withdrawal management, and respite care, among other services immediately available on this campus. In my many years of working in hospital environments, I've not previously experienced the level of enthusiasm and support for behavioral health treatment as is being expressed by our board of directors, our executive leadership team, our providers, and our employees. Everyone associated with Heart of the Rockies really appreciates this and is looking forward to it getting off the ground.
There is not the same attention given to our rural and frontier communities on a whole lot of issues, but especially mental health and substance abuse, as there is in our metropolitan areas. And so when I think about how to describe what this moment means to me, it is nothing short of a transformative paradigm shift. We're no longer going to accept the fact that we have a 13,000 square mile swath of Colorado that doesn't have access to higher levels of care for mental health and addictions. We're no longer going to accept that our fellow community members, our family members, our friends, ourselves have to drive over 100 miles to the Front Range and I-25 to get the services that we need and deserve. This represents a serious change, and an opportunity for us to really invest in the health and well-being of rural and frontier Colorado. And the coolest part is that it's thanks to the people here today and across not only the 4 counties that Solvista Health serves, but even more. Beyond that, I'm talking about every single county Department of Human Services, every single county public health department, every one of our hospitals, St. Thomas More in Canyon City, St. Vincent in Leadville, and of course, Heart of the Rockies here. Every single sheriff's office, every single police department, all of them signed on in support of this project and directly informed not only the design of the building, but the programs that are going to be inside of it. That's a big deal. And that represents exactly what rural Colorado is all about, which is grit, just relentless optimism, and perseverance to make sure that we, again, get the services that are needed and deserved here in our part of the state. So thank you to everybody I just mentioned. Thank you to GH Phipps, our general contractor. Thank you to Heart of the Rockies and your board of directors for the amazing support. HGF, our architects. Thank you to everybody for coming together and making this project possible. I am so excited to finally be moving some dirt. I'm not planning on flinging the dirt too, Chris. All right, move dirt. Yeah, we got time for the dirt.